Different cities, different provinces, but the same warning.
All across Canada, doesn't matter where you are, it's very likely that Omicron variant, the BA2 sublineage, is spreading quite widely in your community.
Federal data shows reported infections peaked, then dropped this year, but they're rising yet again. And limited testing in parts of the country means the true number of COVID cases is likely higher. In Nova Scotia, where there is still widespread testing, the province is now averaging roughly 1,000 new daily cases, a new pandemic high.
I am deeply worried that people don't understand this is already here.
Saskatoon's latest wastewater testing shows a more than 700% increase in viral load.
More people are going to end up in hospital with, the stretching the already exhausted healthcare system.
Already, hospitalizations are ticking up in multiple provinces, including Ontario, where more than 1,300 people are now in hospital. Emergency physician Dr. Steve Flindle says many of his recent COVID patients were unvaccinated seniors and people far younger.
I see a lot of kids. Like yesterday, I had at least a half a dozen kids under the age of 5, all in with fever and typical COVID symptoms. A couple had already tested positive on rapid tests.
To blunt this latest wave, the key message from Canada's top doctor today was get a booster shot as soon as you're eligible.
Even if you've been infected, you should get a booster, but you don't really need to get it until about 3 months out from your documented infection.
That advice is still meant to be layered on top of other precautions, like staying home when you're sick and wearing a mask, whether or not there's a provincial mandate. Lauren Pelly, CBC News, Toronto.